This is Steve Zeltzer with WorkWeek, and WorkWeek has covered the issue of discrimination against public workers in San Francisco, and also the issue of outsourcing and privatization of public works. And right now, there's negotiations with the city workers in the city and county of San Francisco about their contract. San Francisco is one of the richest cities in the world. It has over 70 billionaires. It has a massive amount of capital, and yet the city workers are under attack and facing not just an economic attack, but also COVID. And city workers have died as a result of not having proper PPE and protection. So joining us on WorkWeek is a number of city workers. Brenda Barros is the president of the SEIU 1021 chapter of General Hospital. Cheryl Thornton is a community healthcare worker. She's also
vice president
of the community health center chapter. And John Wadsworth is the vice president of the San Francisco General Hospital 1021 chapter. And Kimberly Cox is also a city worker and also was elected to the bargaining committee. Welcome all of you to WorkWeek. So the negotiations are going on now, and there are a number of issues that are critical to not just SEIU 1021 members, but all public workers. Maybe you can talk about some of the issues dealing with and why these are important to public workers and all workers.
The one thing that we should talk about is, yes, there is beginning discussions about bargaining going on. But, you know, as Cheryl was saying, there is an undertone, and unfortunately that came from our union about rolling over the contract and basically not negotiating because the city is because of COVID, they believe is not ready to do a real bargaining. And, you know, the general census in the room was totally rejected that. So that was good, right? And some of us rejected that. But there's a lot of different issues with hiring. Over the last 2 years, they've been hiring people. And now, just to put it into context, we have been pressuring the city because there has not been enough hiring of Black workers in any department. And the Black workers are being harassed out of their jobs, disciplined more. You know, it's been proven. The mayor of San Francisco, she ordered a report by Dr. Gould, and it pretty substantiated everything that we've been saying, this report. But I think that what's been happening is, yes, they have been bringing some Black people in, but what we are discovering is that none of them are permanent employees. And we're also discovering, or very few of them are permanent employees. I won't say none, but very few of them are permanent employees. That a majority of the people being hired are temporary workers in temporary categories. With a lot fewer protections than a permanent civil service city worker would have. And that is a huge issue amongst all unions. And so all unions are starting to speak up about that. And that leads us back to contracting out our work. And a lot of it has been people contracting out our work. Where I am, which is COVID, right? I'm in the COVID center where we're dealing with COVID, and we're the ones who take the calls from the people with their questions, if they're positive and all of that. But even with that, what I'm noticing is that when even TEX, which are temporary positions, come up, the contractors are being placed in those positions, particularly the higher positions, the positions of authority, the management type positions. And a majority of them, since I've been there, and it's been over a year, have all been white. And they're all coming from nonprofits. And so Meta has an indefinite contract, I heard. And so other nonprofits are getting these huge contracts within DPH. But on the other hand, DPH is saying we don't have money to fill positions. That's what they were telling us, right? But when we talk to the supervisors, some of them, they say, wait a minute, we approved everything that DPH asked for. So there's no reason that they shouldn't be able to fill their positions. So that's the current battle that's going on now. And one of the supervisors, Matt Haney, he's going to be out at San Francisco General tomorrow, again gathering information from workers, because I'm glad he agreed to come out and listen to us directly and not listen to 1021 and not listen to anybody else, but to talk to the workers directly. And so that has prompted a hearing that's going to be coming up about this issue of why, if the budgets are there, the money has been given to them from City Hall, why are they not filling the positions? So, that's what's going on right now.
And this is a long time effort, I believe, to take away civil service, to lower civil service. So it also has an issue of nepotism and corruption, because if they can bring in who they want, their friends, their cronies, nonprofit contractors, who's doing the oversight?
Can I just add one more thing, Steve?
Sure.
This is not about those workers who work in the nonprofits. It's not about those particular workers. But what it is, what they're building is they're building a conflict. And that conflict is even within our union, because the largest nonprofit that's taking jobs away from public health, they organize, and now they're a part of our union too. So you have one side of the union basically taking jobs from the other side of it.
And the nonprofit workers, and there's a large sector of nonprofit workers, not just in San Francisco, but throughout this country, have been doing jobs that public workers have done. The workers who clean the streets, these business districts in San Francisco, they're doing public work, but they're not getting the benefits and conditions of public workers. Cheryl?
Yeah, so you know what? This is what I want to say, what I've seen. A lot of our public workers, they're not educated on the labor movement, nor do they have a health benefit when they retire. So, the city has been angling for years and years and years to figure out how to get from under that with the city workers, the public workers. But this was all part of the labor movement to get these type of benefits for workers. So now the city has figured out they want to have, they'll fund some of this stuff, but they don't want to have the burden of the employee. So as Brenda said, the contracting out, case in point, Health Right 360. Our union organized Health Right 360. They are in a separate bargaining unit from us. And they want what we have, but they're not city workers. They're taking our work. We've lost over 60,000 patients to Health Right 360. Now, some of those people are coming back, but not all. So, and the people at Health Right 360, they get paid probably half of what I get paid. So, but the thing is that even if they win their contract and they get equal pay for equal work, they still don't have a benefited retirement. And so I believe that what they're going to do is in public health is close some of the clinics and say that, Health Right 360, the people have changed and we're going to keep these amount of clinics and they're going to consolidate. And then what does that mean? Retirements and layoffs. So this is what I see. And I'm really concerned about how then they want to not bargain this year and keep us static while everything else has gone up. While we were essential workers working on the front lines in the trenches throughout the pandemic with our lives at risk. No, this is not right. And so that is what I see going on as far as the contracting now. And I feel that our union, they're in favor of this because they organized Health Right 360. And they, like I said, when they first came, the city gave them a building. They gave patients of ours, and now they have their own network line of business into the hospital. They have their own clinics and their own network. So there it is.
And one of the issues I know that has been brought up about Healthcare 360 is apparently the contract what they have with SEIU 1021 is not available. Can you talk about that? Why SEIU 1021 would have a contract with Healthcare 360 that's not available on their website and available to the union members about what they're being paid and their conditions and contract conditions?
Well, Steve, the reason it's not posted is because people would be alarmed if they saw the number. It's just like the UCSF contract. They will never, ever show us those real numbers, ever, because they know what's going to happen if people know that they're really ciphering all this money out of the Department of Public Health and giving it to, and the Health Right 360 says it's a nonprofit, but it's not a real nonprofit. It's really not. So, so you're ciphering public money and giving it to a private entity who mistreats employees, doesn't pay people fairly, refuses to give them a pension, but that's where the money's going.
And when you're talking about a two-tier system, and it's the same with charter schools, charter school teachers are mostly paid less than public school teachers, and they don't have the benefits and conditions. You're setting up a two-tier system where there's an incentive to go to charter schools, an incentive to privatize. And it seems like that is the exact same thing that's happening with public service jobs. Kimberly?
Exactly.
Okay, John, do you want to speak on this issue of outsourcing and privatization? Because you've been fighting at the pharmacy at San Francisco General, big business, drug companies, a lot of money involved.
It's fairly complicated, obviously. I mean, Brenda's talking about the union being involved in some of these contracts, these outsourcing contracts, and they began as where we only had a few members, and then we brought on some of those to become union members. But there's a big, from what I understand, there's a lot of the employees are not unionized yet, and so you have deals being made between the union and the city to do city work and to outsource big parts of it, right? And so it becomes a fairly complex conflict of interest between the union members that they have now that they should be bargaining for in their contracts, and then these other outsourcing contracts that have these trickling in union members that are becoming union members, right? And so with having different bargaining chapters or different bargaining groups, really they're bargaining against the better interest of some of the larger and established groups. And so in these outsourcing contracts, they begin to lose scheduling rights. They begin to lose, they're not establishing the same seniority rights. They don't have the same benefits. Now, obviously, Cheryl, was talking about them not having the same retirement benefits. Now, these are all austerity measures, all of them. Now, if the union is going to negotiate and bargain, with these outsourcing groups, in the hope that they'll become union members, it works against our contracts. It works against our ability to negotiate for something better than what we had before, even if it's scheduling rights or seniority rights or reassignment rights. I mean, across the board, it becomes a deficit to the current bargaining groups. So I don't know how we got to this point, but I know that these are heavy austerity measures that are taking place in the city.
I want to make a comment on that. I didn't want to make a comment in second person, but a good friend and ex-colleague of mine works for the Department of Public Health. And what she told me was that although they have all of the workers on the front lines during the DSW work for the last 2 years, they're telling them to go back to their old positions. And then they've contracted with an agency. And this agency is placing employees in these positions that these civil servants should be offered, but they're not offering them, which is better pay and a lot of times and somewhere where they can make more money, but they're sending them back to their old positions and they're bringing in people from the outside. Just like you said, without all the benefits and what have you. And I think that's a travesty. We have the people there that have been doing the work for 2 years. Why not let them have those positions?
And the issue of austerity, privatization, outsourcing, has there been any education on that? Has that been brought up in the union, and to say, let's look and investigate to see what jobs are being outsourced or being contracted out? Because I have been to the Civil Service Commission and they're voting on tens of millions of dollars, 30, 40, $50 million contracts for other agencies, UCSF, this agency, that agency. And there doesn't seem to be anybody watching that and holding them accountable. Where's this money going? Could this money be done by public workers?
Well, what I was going to say real quick is that it's so funny you bring that up about the Civil Service Commission, because all this money's coming up there to the commission and they're approving all of these contracts. And no one's questioning anything, not even the commissioners. How long can this go on? I'm just like wondering what the commissioners should be questioning every contract and asking, why are we contracting all this work out? Now, I have heard Commissioner Forbetti say it, mention it sometimes, but no one's done anything about it. Now, our union claims says that they're fighting all these TEX hirings and that they want to put together a campaign. But if they really were worried about the TEX, they would be up at the Civil Service Commission protesting about all of this going on, but they're not. So there it is.
Well, have you gotten the figures, for example, of the percentage of money that's being contracted out? All these private contracts to nonprofits and other consultants. I mean, it's a massive amount of money. Who's doing the research to find out how much money is being spent outside public jobs? That's the basic question.
Well, one of the problems, Steve, is I guess it would have to be one of those things where you get them to relinquish it legally. But those are the numbers that maintained as secret. They won't even let other union members see what they negotiated. They had a rally. They didn't even tell most union members they were having it. And so they're trying to really keep it totally separate. So we don't find out, because they know what the reaction is going to be. So this is a dilemma that came about in 1021, I believe, when we had a change in leadership. Most of the people that were in leadership came from nonprofits within our union. A lot of them that are still there, including Joseph Bryant. He moved to a city job later, but generally he came from the nonprofit world too. And so they're about increasing their benefits. They're about maintaining our benefits. That is the difference. And that's the pressure we feel, right? It's like, why are they just allowing us, trying to keep us status quo, while they're working so hard to get these other people up? Now, they would say to us, it's like, you guys are greedy city employees, you make more than they do, but there's reasons we make what we make, right? There's civil service rules. We don't set our own salaries. So that is a bogus argument. But what I will say, I'm not against other people coming up, but don't stifle us and make us sit back and wait for the other people to come up, and then you start trying to bring us all up together. That's just not going to cut it.
But my question is, why not expand city work to cover those services and bring people in and pay them for city work?
I mean, that is the issue. I mean, there's been a hiring freeze in place for, I think, better of 7 years, I want to say. And when they, implemented Epic, the whole measure, was to, streamline services and increase its efficiency and really to do more with less, and so that, now that, we are Epic's in place, and they're firming up, whatever services and departments that are, that are remaining, now they're looking at, the tail end of what I would call, a corporate austerity agenda, and they're shoring up, what's left of these city jobs. Now, every time somebody's pushed into retirement or early retirement, or they become, injury cases, and they're no longer can work, these positions, because there's a hiring freeze, a lot of these positions aren't being replaced. Instead, they go to TEX, they go to agency services, and this is what's happening, across the city. And somehow the union is bargaining for a lot of the outsourcing groups, because they have a few union members in these agencies, and somehow it's become these two pots of money, where, like what Brenda was saying, where one remains stagnant and the other one is constantly being fed, and the same city services. I mean, this is how we got into these issues with two-tier pay scales. This is exactly how this happened in previous years prior to my involvement. Brenda had explained to me how this had happened with other classifications. And it seems like, this is the same thing, but it's on a larger scale, a grander scale.
And this is happening not just in San Francisco, but statewide. Healthcare 360 has a statewide contract. The SEIU is supporting it. It's going on not just in California. Outsourcing is going on nationally with a lot of this federal money, and setting up nonprofits doing the work that public workers are doing. And that's probably the reason they don't want to release the contract, which is illegal for them to have a secret contract with Healthcare 360. The fact that union officers, chapters have asked for the contract, they can't get it from Joseph Bryant. Why can't you get the contract from Healthcare 360? Why not? It's part of your union. And obviously, you've been saying the reason is that a lot of workers who are public would be very concerned to see that classifications doing the same work you're doing are paid 30, 40, 50% less without the benefits and conditions that public workers have.
True, and Cheryl will also tell you too. She's seen it, and when I worked in the clinics, I saw it. They wooed the people in. The system feeds people into their system rather than our system. Like if you call a certain number and you say, I need a doctor, they're going to feed you into them and not into the public health system. But what we're finding is that some of these patients, when they get over there in that system, they are very unhappy. They don't feel welcome. And some of them come back. I don't know what percentage come back, but a lot of them, they go over there and then they come back. And a lot of it is because if you look at the makeup of who Health Right 360 hires, and I was in one of the union meetings where I saw them come in, and so I saw who was in the room. There are very few people of color in that organization. It's run by a white female, and a majority of the workers are young white people. They have an occasional person of color, And I believe they just have them in there. That's what they had to do to get the contract, because you can't get a city contract unless you prove you hire minorities. But, you know, there are a lot of internal things that we're fighting in the city that are also happening within that organization, and they're not being addressed in the private sector at all by anybody.
I want to add something, Steve. Hellfire 360 was. Hellfire 360 at one point was Delancey Street and Walden House. Walden House pretty much was run, it was a drug program. They had drug programs that were run by a lot of men from the pipeline to prison. They came out and they were working for Walden House doing drug counseling. That was swooped up by Delancey Street. So now Delancey Street is Hellfire 360. It has converted and become Hellfire 360. And it, like you said, it has a state contract. It's going up and down the state of California. It's not only going to knock out public workers in San Francisco, they intend to knock out public workers all up and down in all of these counties, because all of these politicians are saying we can't afford to pay benefited positions anymore. Kaiser doesn't do it. UCSF doesn't do it. Or whatever other health organization there is. They don't pay these type of benefits to these workers. So again, you know, this is what is at stake. And that our union, who is now, you know, they organize McDonald's, they organize Starbucks. It feels like SEIU 10-1 has just become a corporate union who is dealing with private companies, and they have lost sight of public workers. There is no education to the public workers about the benefits, and let's fight for them. There's none of that. They're just like a big conglomerate, just wanting to take members from anywhere in and then organize them and then get paid, because it's almost as if they know that we're going to be gone. So they have to replace us.
And this raises the issue of the current negotiations, because apparently there's an issue of getting representation on the negotiating committee and keeping people out of the negotiating committee, which may have something to do about the issues that you're raising here tonight. So maybe you can talk about your fight to get representation on the negotiating committee.
You know, the way it's worked is they had elections, right? And people ran for the bargaining team. Now, one thing that is problematic about the way that elections are kind of done is 1021 has taken the stance, even for the executive board elections, that there's no communication. Like even for the election for the actual officers, this year there will be no election. Why? Because only the people that they talked to and wanted them to run for an office were truly notified the way people should have been notified. So they put in their paperwork, and so they're going to be in those positions. And because of the lack of communication to the members, because of the lack of promotion, encouraging employees to run, the reps could not talk about it at all to their workers. They were instructed not to talk about it at all. And so what's happening, there is not going to be an election. Those people just go in, and the president of our union, 1021, is just going to appoint people to fill all those vacancies. There's not going to be any election this year.
You're saying the members have not been informed by the staff that there's even an election, and let everyone know that if you want to run, you have an opportunity to run. That hasn't been done.
But what happened was they sent out this shoddy, and I kept it, but it's just a little shoddy paper thing. It's not in an envelope. It doesn't say SEIU on it, but it just says election information. I mean, it's what most people probably would have considered junk mail. And if they didn't open it up, they would not know what it was. And I believe that was not unintentional. I think that was intentional, and they got what they wanted. People didn't know about it. People didn't apply to run for office. You know, I read it word for word, because I read things, I get word for word. But most employees, when you get all that junk mail, most people don't even open it. There should have been verbal communication. They should have been announcing it at union meetings. I mean, if you really want your members to know about something, that's the way you do it. And I've talked to Joseph Bryan about that. And I say, whatever it is you're working, his argument to me was, well, we're following the rules. I say, well, whatever your rules are, if your members aren't notified and they don't know about it, then it's not working and you need to change it.
And isn't that business unionism, corporate unionism?
Well, I want to add something to a point to this. So Brenda mentioned earlier, Steve, about Professor Gould's report. And one of the things that we complained as city workers, Black city workers, is all of this business about appointing people into positions with no transparent process whatsoever. And here we are in the union. We've been fighting against this, and yet they do the same thing. So the election, I'm in contact with my union rep on a daily basis. Not once did they tell me about an election that was going on for the e-board. Not once. And when we questioned it, when I said I didn't even receive a mailer, a flyer, they said I probably need to update my address in the member services, although my address is current. Now, they said, well, it was on the website. So as Brenda said, we're not even going to have an election. It's by what do they call that term? Acclamation. I forget the term. When there's no
acclamation.
Acclamation. There's not going to be anybody. Now, why aren't they raising leaders to fight this fight? They want us to be out here to fight the fight, but you have to raise leaders. They're not raising any leaders because they're suppressing an election. So they're suppressing leadership. They're suppressing this. And you know why? Because they're engaging in that same behavior of cronyism, nepotism, and all the isms above. And it's just terrible. And we pay our dues. And this is what we get.
No excuse why they should have not notified us. They have so many ways of getting the messaging out. They have a thing called purple messaging. They come to our text phone, to our phones, emails. I never even knew till Cheryl said something. I didn't know there was an election or what have you, what the status was. So I'm sure everyone else is unaware as well.
So they never texted you. They never used social media to get the word out that there was an election.
Anything else that they want me to know or to attend a meeting or something, but they didn't send us anything.
So is that democracy? You keep the election.
The easy answer is no.
You keep the election
It's
secret
the
from
same
the members?
people, and what makes it worse, Steve, is the same people. They just shuffle them into different positions. It's the same people.
Right. Same people, and we are getting the same results. And they moved one from, for example, from social justice chair because he had termed out. They moved him now to the retirement chair right before the term ended, so that he would be in that position and he could run on their what they call that, their slate. So he was already in place. This is the stuff that they do. And as Brenda said, there's several vacancies, but the president of our union gets to appoint those vacancies. And once again, there's no process.
You've been trying to get on the Labor Council for some time, haven't you, Cheryl?
Well, I'm actually on the Labor Council, and I was on the bargaining team last time, but I had a member who nominated me and something went wrong. So I wasn't able to get on the bargaining team this year. But because only 3 people ran on the bargaining team, there was not an alternate. So I asked what was the process to become the alternate for the bargaining team. And I was told that by Teresa Rutherford, the vice president for San Francisco, that I would need to have my chapter take a vote. So they took a vote and we won. I won. And then she said, no, she changed the process again. And it's because she doesn't want me on that bargaining team fighting for social and economic justice for our members. And she doesn't want me on that bargaining team because I'll be educating people about the outsourcing that is going on. So, you know, like I told them, we don't have a democracy when you don't have an election. And shame on you when you don't develop leaders. And shame on you when you suppress people's voices like mine. I lost a worker in the pandemic this year due to COVID. He tried every which way to get to telecommute, and they would not support him, our union. I work in the Tenderloin where people are getting killed every day. We're down there in danger. And yet they won't even allow me as a member of this union to be an alternate. And another thing, they're not even allowing members, I don't think, to be able to come to bargaining and sit and listen. And previously, all members were allowed to come to bargaining on their own time and listen to the negotiations. They're not talking about any of this. All they're talking about is a rollover, because all they're interested in is contracting us out.
This is the first I've heard about a contract rollover. I mean, it was my impression that, you know, we would be talking about that tonight. You know, that you know, they're not allowing alternates and allowing persons to participate in and be in the meetings to listen, you know, to the negotiating that's taken place so far. I know that Brenda had mentioned that, you know, a lot of this had to do with the COVID mandates, and that, you know, because some of us, you know, are you know, on disability or medical exemptions or religious exemptions that are pending, you know, there's a group of people that, you know, are not getting vaccinated. And so instead of, you know, they're making these accommodations, you know, possibly ADA accommodations for persons on disability, or making accommodations for people with medical exemptions or religious exemptions, they're not providing those, providing that for persons that would be on the bargaining team. And so I suspect that, you know, now they're talking about rolling over the contract because, you know, that will solve that problem. Because right now, I mean, there's several persons that are being left out of negotiations, and I mean, correct me if I'm wrong, Brenda, but I think that has a lot to do with these persons, you know, having their vaccination status not being, you know, what the city.
And that is an issue. And the other issue is that the Public Employees Committee, and we found out purely by accident, that wasn't announced to all the workers either, signed
What
an
is
agreement.
what is the Public Employees Committee?
Public Employees Committee is a group of public unions, and it's organized through the San Francisco Labor Council. And so rather than having all the public sector workers fighting each other about things, it's a place for them to come and work out things. But what the city has done is they have suscepted that most of the members on the bargaining team being involved by calling these meetings with just the PEC and discussing basically bargaining. They bargain that people who are not vaccinated can be terminated, and they signed that agreement. And I am outraged about that. I don't think a union, even if the city was going to just implement that, they should have never signed off on any agreement that agrees that our people will be terminated.
David Canham is the chair of that, or co-chair of that committee, along with Rudy Gonzalez.
Yes.
So has he been questioned about why he would sign off something like that without going to the
Well,
membership?
let me tell you this. I am a member of the PEC committee. I was not informed about that meeting. And then when I challenged them on that, why are all the members not invited to that meeting? They said, oh, it was an emergency meeting called by the mayor, and that that there was a team of people working on it. So my question to Joseph Bryant was, who selected this team? Who selected this team? Because they certainly didn't speak for me if they signed off on that. So I think they intentionally wanted people there that were just going to go along with whatever they said.
So they wanted
handpicked a
rubber
group of people.
stamps. They
They
rubber
wanted
stamp.
people that were going to be there to rubber stamp what they said. And that's what they got.
And the
And now
members,
that agreement is in stone, signed by the union. And so if those employees go to sue because they get terminated or something, the city is going to use that to say, well, your union agreed to this.
Wow.
So, you know, sue your union, don't sue us. But yeah, I saw the agreement. And I was like, I couldn't believe that they signed off on something that
and if the
actually
members,
said workers can be terminated.
yeah, have the members been informed of that?
No, most members still don't know it's out there. They still don't know it's out there. I've shared it with many people as I can share it with, but the union, I told them, you guys need to send this out to everyone. And this should never have been voted on by a small group of people sitting in that room.
So
that should have been a full bargaining team decision.
Sure. Who voted on it? Who were the people that voted on that?
Well, you know, I know that Joseph Tanner was there. Who else was there? I think Nicole Christian was there. He named off a few of the people that were there.
So it was
So there were bargaining team members that were in the room. There were some bargaining team members in the room.
But SEIU is the largest union in the city, the public workers. And yet you're saying that the bargaining team of the SEIU were excluded on an important bargaining issue of the right.
Yeah, on an issue like that, it should have never been decided that way. You know, they let the mayor's office pressure them. And you know, they pump each other up. It's like, we're the leaders, we're the elected ones, and we make the decision. It's that kind of mentality in that room. It's the same thing that happened with Prop C when they gave away our pensions, basically. It was the same kind of environment, same kind of pressure, I believe. And now they don't want to talk about it. They just want to talk about what's happening next in temporary workers, which is important. But we got to talk about that.
I'm in shock right now, right? Because I'm one of those employees. So I just need to clarify something. So what they agreed to was to terminate all of those that were
what they signed an agreement, and the last sentence of that agreement says that people have until April.
Right.
And then employees who do not get vaccinated will be terminated. That's what it says.
Yep. They already have the skellies there. So that's what, yes.
And they're not going to withdraw the skellies packages that they got. They're going to leave them in what they call an abatement until April. Mm-hmm. But in April, they're going to act.
My impressions, my thoughts on that, Brenda, Cheryl, and Kim, is that I think before April rolls around, I think that the vaccine mandates will cease. I think that's my thoughts is that by the time April rolls around, that they'll become voluntary at that point.
Yeah, but I mean, the issue of testing, is there a mass protocol for testing of workers? Because I mean, it's made does everybody have an opportunity to get tested if they want? Like once a week or 3 times a week?
That's the bigger issue here. You know, when they brought the bargaining team together for these meet and confers on the COVID mandates, we had, I think, between 5 and 7 meetings. Now, I was there for all of them, but the first one. And each one of those meetings, there were agreements that were made between the union and the city. Now, what Brenda's telling me and had told me was that the agreements that we made in the last few meet and confers were null and void. They were null and void at this point. Now, I don't know if that's absolutely true, but that creates a huge issue for some of us that were in the meet and confers that are affected by those agreements and the communications that were made to the chapter members and to the departments. We had an agreement that everybody would be given an N95 at no cost, every city employee. was be given an N95 with request. We were made an agreement that they would extend once a week testing to all city employees, that were not able to get vaccinated. Now, there are persons that are not able to get vaccinated because of medical conditions. They exist. There are persons that do have legitimate religious exemptions. And so them not extending the agreement to give testing to these persons, essentially, washes away everything everything we met and conferred on and agreed on. And so now these persons could lose their jobs because the city is not adhering to the agreement that we had. I mean, how does that happen? How does that happen?
We had a meeting the other night with our executive leadership for SFMTA, and the HR director gave us the figures of how many applied for the exemptions. They haven't gotten to the religious ones, so that's pending. However, on the medical ones, nobody's been approved. How is that? And I told her, I'm one of those. I had a legitimate doctor gave you guys legitimate documents. How was that? And then my other colleague asked them, who do you have giving approval or disapproval? They're not medical people. They're just HR analysts. What do they know about someone's medical condition? And who are they to make that determination? So we have people right now about to lose their jobs.
So, Steve, the other thing is the new bargaining team has not really been seated yet. And this stuff was being bargained in the previous bargaining team, and which that bargaining was abruptly ended, and it was ended. And we didn't get the resolution. So we could never, so then we ended up into this global agreement that they had to go with the PEC, but they never went back and notified the bargaining team that still should be in play until January 1. They never called us back and said, wait a minute, we need an emergency meeting. What do you think we should do? I mean, maybe we would have taken a different position and said, strike. Now that we have the ability to strike, I don't know, but we weren't even given that option. And so this is what Brenda's talking about. No communication. Even when you are on the bargaining team, we are losing the right to exercise our voice. And then for them not to notify everybody that this global agreement happened, I mean, some people are going to lose their jobs. How is that?
Well, I mean, if they're allowing your rights to be taken away and not informing you, and bypassing the bargaining committee and negotiating away your rights, then that's an issue. That's a violation of your rights. I mean, you have the right to be, you're represented by the union, and the union should be straight with you about what's going on. Have meetings with you. I mean, have a vote of the members. But it seems like that's not going on. The members are not being informed about what they're bargaining on.
I mean, I think it is a collective bargaining violation to have meet and confers, make these agreements and confer on these agreements with the entire contract team, and then, break from those meetings and then agree to something else, and even, take out some of the agreements that were already made. I think that is a violation of contract rules, contract negotiating, collective bargaining rules.
And the issue of a strong union movement, there's strikes of the Kellogg's workers, there's strikes of miners. There's a growing anger in this country about the treatment of workers, 2 tiers, which we now have in San Francisco among public workers and private workers. It's a 2-tier system. And I understand that city workers, public workers are working with workers who are making less doing the same work. Is that going on?
Well, I would say yes. Whoops. Yes, that is going on. and not everywhere, but in many places. And as the number of contracts increase and the number of contracted employees increase, it will be happening more and more and more.
So then the issue is what to do about it. And what should workers do about it who are concerned about contracting out, about the lack of transparency, and about the fact that the bargaining committee is being bypassed with global agreements or PEC agreements without informing the members about these agreements.
Right. Now, I can't speak for the other unions. I don't know if they notified their members or not, but all I can speak to is what happened in our union. So maybe they did notify their members. I don't know because I'm not in those unions, but I've talked to people that were in Local 21 that didn't know about it either. So
it's being kept secret at the top level for the most part.
Yeah, I think the unions wanted to be done with it. So they signed this agreement and now they're done with it. But the problem is that all the workers that are impacted by this agreement are not done with it, and rightfully so. So, you know, what do you do? If your union says they're done with it, that's telling you I'm not going to fight for you. That's what it's telling to me. If I was me and I was one of those people, that's what I would be saying. They're pretty much telling you they're not going to fight for you.
I wanted to bring up something. Historically, people of color have mistrusted the medical system, and rightfully so, due to the harm that has happened. And a lot of these workers that exercise their right not to be vaccinated, for the better of their health or because of religious reasons, a lot of them, from what I've been talking to, are people of color. And so I just think that once again, because the way that we are expendable. And so, in fact, I think somewhere in this, the implicit bias came up because a lot of these other unions, some of them, a lot of their workers did comply. But I am willing to bet that these are people of color because that's what is historically who mistrust the medical system and that are not taking these vaccines that were created because they don't trust it. They don't know what might happen to them. So I entering into these global agreements, just throwing people away like a piece of garbage and not looking back and just say your job is, we did what we could. It's just, how is that a union? A union's supposed to fight for you.
Did they ever provide N95 masks for all workers? That's a question I have, because one of the things I think that people should know about in Taiwan, 23% of the people are unvaccinated, but they've been able to crush the virus. In China, a large number of people. In New Zealand, people have been unvaccinated. They're able to crush the virus. But if you don't have a public health policy of massive testing and tracking and making sure that they're masked and proper mask placement on the mouth, you're going to have transmission. So you have to have a public health policy, but that really doesn't exist, it seems. Everybody's on their own. And if they can't even defend the Department of Health workers with massive testing to protect them, they're going to die. And this brother that died, Ludwig, should not have died.
No,
should not have died.
It was not given an N95 mask,
even though there was an agreement that they were to be provided masks.
Had one of those health that was listed. One of the the health conditions that they said that would be bad if you get COVID. And he wasn't allowed to telecommute. He wasn't allowed to have an N95 mask. And it's really bad because we work in a very high, in the Tenderloin, there was a high propensity for positive COVID cases.
And what has the union done to publicize this issue?
They haven't done anything. They didn't, I know Ludwig and I, we begged. We went to the mayor's office, we went to the policy person, we went to HR, we went everywhere we could. I tried to fight with him. I tried to protect him, but by myself I couldn't, and my union didn't fight for him.
Did they
And
know
now
about his
Ludwig
situation? Did they know about his situation? That he was vulnerable?
with all kind of letters to the union. He was begging the union for their help.
So he's murdered, basically.
Yeah, he's
They
gone.
they put him in a situation in which he would be murdered. He would die as a result of negligence, criminal negligence, in my view. If somebody is vulnerable because of their health conditions and they're put into that situation, they're going to die.
Yeah, but and you said about the N95 mask at the hospital. Let me tell you what's going on. Depending upon your job, right? Certain people, they're being told they don't need an N95 mask, and they're not going to give it to them.
So this is 2 years after the pandemic, and you're still fighting in the Department of Public Health and General Hospital for N95 masks.
Yes, basically.
And the essential workers were right there on the front lines all day long, the essential workers. Now, what we did get was 80 hours of COVID time, but that's about it. 80 hours to use for sick, but no protection.
I guess they don't value lives, especially if they're black and brown. That's pretty obvious. I mean, did the union know that Ludwig died? Were they aware of that?
Yeah, I brought it to their attention several times and nothing was done. You know, they didn't show up to his funeral. They didn't send the family a card. They didn't try to outreach in any way. He was our brother. We are supposed to be brothers and sisters. And not only that, the union never even looked back to see if we needed EAP. How do you think I felt as a supervisor? I was totally traumatized by the whole thing, you know, and no one ever reached out, crisis intervention. They didn't ask me anything. If our members needed any kind of support, nothing.
Well, it's an issue that has to be addressed because it sounds like it's actually going to get worse if it's not addressed.
Well, I would say that there does need to be more discussion and about this in particular. Now, what I don't want to happen is all of the other issues to get washed away by this one important issue, but it's not the only issue. That's all I would say.
I want to thank you all for joining us on Work Week. I think this is a life and death issue.